Good morning, everyone. Thank you for joining us to discuss Medicare coverage of alcohol misuse screening and counseling. My name is Karen Curtis, and I am a provider outreach and specialist here at WPS. Today, I am joined by my friend Bailey Lawson. Bailey will be monitoring the chat for questions, as well as providing you with some additional information and links. I have a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and you'd like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center. Here you're also going to find a list of our upcoming events. Bailey will also add a link to the chat to get you there quickly, so if you need to download the material, you can just click on that link and go. Our training center also contains a web page for our encore presentations. Videos are available for up to 90 days and can be watched on our web page without you having to go to YouTube. We know that some companies don't allow their employees to access YouTube from company computers, so we want to be sure that you can get the education you want. Today's presentation is being recorded, and if there are no technical issues, then we will have it posted out to our website soon. Later, there will be a question and answer session if time permits. If you have any questions related to today's topic, please send those using the chat feature. I did receive some pre-submitted questions, which I plan on answering at that time. And also, if there's any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in this presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what we're doing right, let us know if you feel there's areas where we can improve, and it also allows you to give us input on what types of education you would like to see in the future. And while this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Now, here at WPS, we do our best to provide you with accurate, up-to-date education. Now, if you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and the federal regulations will take priority over anything presented today. I also need to let you know that we will answer questions based on the facts given. If changes to that information may change the response given. We also are not able to guarantee payment for service. Medicare rules will always determine final coverage of services. And if you do have a claim-specific question, we do ask that you contact customer service. They do have the ability to access your claim and provide you with an answer based on how your claim processed. Lastly, I need to let you know that CMS does prohibit the recording of this webinar. We are recording this event so it can be posted to our Encore Presentations webpage and YouTube channel, and it will be available in case there's anything you missed or if there's information that you would like to share with somebody else in your office. Now, each month I choose a preventive service to discuss Medicare coverage. My coworker, Jennifer Boniface, does the same and does it from a clinical aspect of view where I cover the topic more on a billing point of view. So today we're going to discuss Medicare coverage of alcohol misuse screening and counseling, as well as how those claims should be billed to Medicare. Now, the world of Medicare contains a lot of acronyms. I've created a list of those that you will see or hear during my presentation. Many of you may be aware of most, if not all of these. I do like to include them in case there's someone who maybe is new to Medicare, or maybe somebody who works in a field or practice where they haven't had to know what all of these mean. So if I mention any acronyms that you're unfamiliar with, you will have the slide for reference. Now, this is a copyright notice from the American Hospital Association National Uniform Billing Committee. This notice is required since I discuss coding that will be included on a UBO 4 or 837I. The American Hospital Association is not responsible for, nor were they involved in the preparation of this material or the information provided today. So first, I'll start off with a little general information. Alcohol misuse refers to the excessive consumption of alcohol that leads to negative consequences for an individual's health, relationships, or daily functioning. It includes binge drinking, excessive drinking, or continuing to drink despite experiencing harmful effects. Alcohol misuse can contribute to physical and mental health issues, impaired judgment, and increased risk of addiction. 6% of adults in the United States report that they engage in excessive drinking, which has been defined as 8 or more drinks per week for women and 15 or more drinks per week for men. That number jumps to 17% when we look at binge drinking, which means that 4 or more drinks per occasion for women and 5 or more drinks per occasion for men. Now here's a look at the numbers when we look at adults age 65 and older. 25.3 million have drank in the previous month. 7 million reported having binge drank, while 1.9 million reported heavy alcohol use. 2.7 million met the criteria for alcohol use disorder. Now, alcohol use disorder occurs when a person has formed an addiction or a chemical dependency on alcohol. Alcohol can also take quite a toll on the body. Most of us are surprised that also affects the way the brain works. It can cause mood and behavior changes. It may make it harder to think and move. We've seen people stumble if they've had too much to drink. Others may get easily agitated or violent. Now, over time, excessive alcohol consumption can cause damage that can impact overall brain function. Damage can occur to blood vessels within the brain, increasing the risk of strokes. Effects on the heart include cardiomyopathy, irregular heartbeat, high blood pressure, and increased risk of stroke. When it comes to the liver, I feel like cirrhosis of the liver is something that many people associate with alcoholism, but heavy drinking can also cause fatty liver, fibrosis, and alcohol hepatitis, which can cause yellowing of the eyes and skin, along with an accumulation of abdominal fluid. Inflammation of the pancreas can occur. This condition is referred to as pancreatitis, which not only causes swelling and pain, but it also interferes with the body's ability to properly digest food. The National Cancer Institute released that there is strong scientific consensus that drinking alcohol can cause several types of cancer. These include head and neck cancer, esophageal cancer, liver and breast, along with colorectal cancer. Lastly, drinking too much can weaken your immune system, making it harder to fight off disease. Chronic drinkers seem to be more susceptible to pneumonia and tuberculosis. So what is Medicare's policies for screening and counseling? I need to start by defining the differences between alcohol misuse and alcohol dependency. Alcohol misuse is drinking in a manner situation amount or frequency that could cause harm to the person who drinks or to those around them. Alcohol dependence is a chronic disease where an individual craves alcohol and is unable to control their drinking. Tolerance increases and withdrawal symptoms occur when stopping alcohol use. Now, these definitions are going to matter when it comes to Medicare coverage. Now, alcohol screening is covered under Part B. It is for those beneficiaries who test positive for alcohol misuse but do not meet the criteria for alcohol dependence. That way, counseling is covered for those individuals. Patients should be competent and alert at the time of counseling. Sessions should be provided by a qualified primary care physician or other primary care practitioners in a primary care setting. Now, for counseling sessions, Medicare promotes the 5 A's approach, which has been adopted by the United States Preventive Services Task Force. Assess is for behavioral health risks and factors. The patient can take a brief behavior survey, assess the patient's knowledge about their condition, what are their most challenging barriers, things like that. Advise refers to providing clear, specific recommendations for behavior change that are personalized to that patient. Relate the patient's symptoms or lab results to their behavior. Agree is work with the patient to develop treatment goals based on the patient's interest and willingness to change their behavior. Assist helps patients create specific strategies to address issues that concern them. These behavior changing techniques can be supplemented with medical treatments when appropriate. And arrange is for following up on action plans and referrals. Provide ongoing assistance and support. Adjust treatment plans when needed. So now let's take a look at how to submit those claims to Medicare. Screening for alcohol misuse should last 5 to 15 minutes and is billed using code G0442. If the patient tests positive for alcohol misuse but is not considered to be alcohol dependent, then they would qualify to receive face-to-face behavioral counseling that would be billed using code G0443. The screening can occur annually, so this means that 11 full months must have passed following the month the last screening was performed. So for example, if the patient was screened in January of 2024, then you're going to start counting those 11 months beginning in February. So that means that the patient would next be eligible for screening in January of 2025. For those who test positive and accept counseling, they are eligible to receive no more than 4 sessions within a 12-month period. Providers should not provide more than 1 counseling session per day. Now, I do want to take a moment here to talk about common working file edits that are set for these services because I believe it's needed in order for you to understand how to submit your claims. Common Working File has created an overridable edit to make sure that the G0443 is not billed more than 4 times within 12 months. Now, additionally, Common Working File is using the date of the G0442 to start that counting period for the 12 months. So let me say that in a different way. Common Working File is using the date when the screening code G0442 was billed to start counting the 12-month period for the 4 counseling sessions. So hopefully that makes sense for everybody. Now for claims billed using the FIS system, Charges may be submitted on types of bills 13X, 71X, 77X, and 85X. Now, any other type of bills containing the G0442 or G0443 will be denied by the system. If you are a rural health clinic or federally qualified health center, alcohol screening and counseling is not separately payable with another face-to-face encounter on the same day. Now, this rule does not apply to the initial preventative physical exam, unrelated services that are billed with modifier 59, or FQHC claims that contain diabetes self-management training and medical nutrition therapy services. For professional claims billed on a CMS 1500 or 837P, services should only be billed from one of the provider specialties shown here. Claims submitted with a specialty other than what is shown on this slide will be denied by the system. I've also listed the applicable place of service, which can be used to bill for these services. And again, any other place of service other than those listed here would get denied by the system. I want to talk about eligibility for a minute so that you can find ways to avoid frequency denials when you're submitting your claims to Medicare. Now you have a few options when it comes to checking patient eligibility. We have the WPS Secure Net Access Portal, which is often referred to as the portal. Users must be registered with WPS to view a beneficiary's eligibility information. When you visit the WPS website, there is a box that takes up the majority of the screen. And this is where you can either register or you can log in if you already have an account. The direct data entry, or DDE, is an option for providers who bill using the Fiscal Intermediary Standard System, or FIS. This also requires you to register with WPS. Users will have access to Common Working File, which provides eligibility information for Medicare beneficiaries. The HIPAA Eligibility Transaction System, or HETS, is available for both Part A and Part B providers. It provides access to eligibility data in a real-time environment, and this option involves submitting files via electronic interchange. So a trading partner agreement is required. Response files are accurate at the time of transaction and should not be interpreted as guarantee of payment. Now, for those of you who are registered for the WPS portal, I did want to show a picture. There is a Preventive Services tab under the eligibility option for beneficiaries, and it does give information regarding the alcohol misuse screening. So you can see here, it'll provide you with the procedure code that was billed. In this example, it has a modifier 26 showing that it was the professional component, and it also provides you with the next eligibility date. So this would be something that you could use to make sure that you are providing the services when that patient's eligible and when you would be able to get paid for those. Now, I have provided a few resources in case you would like some additional information. I would like to show you one of these because I think it's helpful regardless of which preventive service that you are billing for. The Medicare Preventive Services tool is something that the Medicare Learning Network put out, and I show this a lot in my preventive services webinars just because I think it's really helpful. Here you can see it has the alcohol misuse screening and counseling. There is a T with a circle around it, which means that it is telehealth eligible. It kind of gives you a little description up here. If we click on that, it does give you a link to the NCD if you wanted more information there. One moment, please. Sorry, I didn't want to cough in the microphone there. Um, but as we go down, it does give you the codes that you could bill. If there is a required ICD-10 code for the service, it would be listed here. Whenever updates are made, you would see information in this box right here. It gives you information on Medicare coverage and frequency. There are some other services, and I'll just show you an example, like for the annual wellness visit. Here you can see new information was added, but depending on the service, sometimes it gives you extra links where you can find more information. Anything that's been added that's new, you'll see in red. So it really is just a good resource regardless of what preventive service you're looking for. So I just wanted to make sure to show you guys that, because I think it would be helpful. Now, before I ask Bailey if we've received any questions in the chat, I did receive some pre-submitted questions during the registration process that I'd like to answer first. The first one was about acceptable documentation examples of the service. A documentation must indicate that service lasted more than half of the specified time threshold. You're going to want to include the actual minutes and what service were performed in the medical documentation. My coworker Jennifer held a webinar yesterday discussing this service from a clinical point of view. So if that's something that you're interested in, that should be posted to our website and YouTube channel soon. But again, you're just going to want to make sure that you're documenting that the service lasted more than half of the specified time, and then those actual minutes and what service was performed should be in the documentation. Excuse me. I did get a question about appropriate use of modifier XY. I am not aware of a modifier XY, so I don't know if that was maybe a keying error, but I do want to take you out to our website. I'm going to click on Part B. And if we go over to the quick links, there is a link here just for modifiers. And if I scroll down, trying not to scroll too fast just in case that bothers anyone. We do have some information on modifiers XE, XP, XS, and XU. So again, I don't know if that was a miskeying error. I have not heard of an XY modifier, but if you meant to type in one of these modifiers, we do have fact sheets on that that could be helpful. Another question I got asked was, can the G2011 be billed for Medicare in the facility outpatient setting, or do Incident 2 rules apply? Now, the preventive services discussed today did not include the G2011. Excuse me, just one more second. Sorry about that. Medicare has put that code into a category referred to as screening, brief intervention, and referral to treatment, or SBIRT services. I am going to have Bailey add a link into the chat. Let me see if I can get this to pull up here. So they did create a whole booklet on this, the Medicare Learning Network, specifically for billing the SBIRT services. And there is a portion in here about billing for the G2011. So I had Bailey add that. I'm hoping that that can provide some additional information and maybe get you some answers that you're looking for. The last question that I got asked for pre-submitted questions is this something that should be performed on all patients, regardless of whether or not they report any alcohol use? I'll start off by saying that services should always be medically reasonable and necessary. There are components of the initial preventive physical exam and the annual wellness visit that has patients screened for potential substance use disorder. There's also components of those exams where you can ask a patient about their alcohol history, but I can't tell you that medical staff should perform this on every patient, regardless of the reason for their visit. Services would need to meet the definition of the codes that are being billed, and the medical records would need to support the decision to include the services on that claim. That is all that I had for pre-submitted questions, so I'm going to ask Bailey if anything has come through in the chat.
We had one question come in, and it says, when billing G0442, do we have to have alcohol misuse, or is this for any patient the provider is verifying if there is actually misuse? I hope this makes sense.
I would just make sure. I don't know what's going on in that office, but for the G0442, it has to, it's for billing between 5 and 15 minutes. I'm sorry, guys, my voice is just having problems today. It's for the billing is between 5 and 15 minutes. So I guess it would depend on how long is that physician or medical staff actually talking to the patient about that? Is it something that meets the coding guidelines? Is it documented? You know, that's all going to be a factor in billing for that code. Have we had any other questions come in?
Nope, that's all in the chat.
Okay, thank you so much. After the close of today's webinar, you should receive a thank you for attending email, and here's where you're going to find your proof of attendance and contact hours for continuing education units. This email also contains a link which gives you an opportunity to provide feedback. If you don't get this email, please check your spam or your junk folder. You'll also need to add messenger@webex.com to your safe sender list. Now, if you joined only by phone, you will not receive this email. So please send an email to the education mailbox with your name and your phone number that you use so that a certificate can be emailed to you. Now, if you think of any questions after the webinar, you do have 7 days to send those in. You can email those to the education mailbox, which is shown here. Be sure to put today's topic in the subject line so that staff knows that your question is related to this webinar and that they'll send it directly to me. Now remember, if your question is claim specific, those should go to customer service. They can access the claim in question and provide you with a better answer than what I probably could. When you disconnect from the webinar today, you will be redirected to a CMS survey. I'm also having Bailey add a link in the chat. Your feedback really does mean a lot to us. We review what you have to say and we do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you'd like to see us provide education on in the future. So if you have something specific, please be sure to put that in there. The redirect is going to look like what you see down here in the middle. We don't have control over how it looks, so we just want you to know that this isn't spam. It's nothing malicious. It is the CMS Qualtrics survey, and if you click on the blue continue, then it will take you to those survey questions. That brings us to the end of today's webinar. I am giving you a little bit of time back. On behalf of myself, Bailey, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.